Endometriosis. Hello, today we'll be talking about endometriosis. Just a subject flag before we start. Endometriosis is a sensitive topic. There'll be references in this presentation to sex, pain and surgery. My name is Mel Gadd and I'm a sex educator with Come the Avis Crew, the sex education company. Endometriosis affects 1 in 10 women and assigned female at birth people of childbearing age in the UK. It's not just period pain, it's a chronic inflammatory condition. It happens when womb-like tissue grows outside of the uterus. Endometriosis tissue responds to menstrual hormones, which causes pain, inflammation and scar tissue. It is more likely if you have a family history of it. And it's not contagious, and it is not cancer, and it's not a sexually transmitted infection. So where is endometriosis found? Well, endometriosis tissue is most commonly found in the ligaments that support the uterus, the pelvis lining, outside of the ovaries, on the bowel, on the bladder, and at the top of the vagina. Endometriosis symptoms can vary from person to person. And the symptoms can include pelvic pain before and during periods, painful heavy periods, pain during or after sex, pain when pooing or peeing, difficulty getting pregnant, and fatigue. Diagnosis of endometriosis. Because endometriosis is a condition that develops over time, it can take quite a while to get a diagnosis. On average, it can take about 8 years to get a diagnosis. Endometriosis symptoms can overlap with other conditions such as irritable bowel syndrome or pelvic inflammatory disease, which can make it harder to diagnose. Please don't let this put you off seeking help. The road to diagnosis may include a discussion of symptoms and taking your family history, tests to rule out any other conditions that it could be, a physical and vaginal examination, and you can let your GP know if you have any concerns, and you can also ask for a chaperone during this examination, a referral to a gynecologist, an ultrasound or MRI, or a laparoscopy, which is keyhole surgery to put a small camera into your tummy. If endometriosis is diagnosed during this surgery, then sometimes it gets removed at the same time. Living with endometriosis. Because there is currently no cure for endometriosis, the symptoms are managed by a range of things, including pain relief, self-care to reduce stress and the impact of your symptoms, hormone treatment to reduce estrogen production by the ovaries, and this is typically hormonal contraception such as the contraception pill, or surgical treatment to remove endometriosis and scar tissue. Endometriosis and university. Although endometriosis is not classed as a disability, it is a chronic condition and you can request support and reasonable adjustments from the University Disability Service. These may include wellbeing support, academic adjustments, so that's practical help around deadlines and attending lectures, counselling or peer support, and please contact the University Disability team to discuss what support can be offered to meet your needs. Sex and sexual health. Endometriosis can impact having sex, and the following things may help. So track your menstrual cycle and symptoms so you understand when your symptoms might feel worse. Use a good lubricant and make sure it's water-based if you're using condoms. Experiment with different positions. Take pain relief an hour before sex and prioritize intercourse when you are experiencing a flare-up. You can still get pregnant if you experience endometriosis, so remember those condoms, use a reliable method of contraception, and take regular STI tests. You can get more information from these websites, including the NHS, Endometriosis UK, Endometriosis Cymru for bilingual information, and the Royal College of Obstetricians and Gynecologists. External and internal condoms, DAMs, lube, and STI test and post kits are all available for free from the Student Centre in the Students' Union and the accessible toilet in the Students' Union. You can access the Student Wellbeing Service through this website, and they will give you a range of different support on health and mental health, and they will signpost you to appropriate local services. BCU HB Sexual Health Services are your local sexual health services. They're easy access, friendly and non-judgmental, free. They offer STI testing and treatment, a full range of contraception and HIV services. This QR code takes you to their service webpage. Public Health Wales have a website called Sexual Health Wales where you can access free test and post STI screening, free condoms by post, and a full range of sexual health information. This is one of a series of video presentations on relationships and sexual health topics commissioned by Undeb Bangor. They were designed and delivered by Cwmni Addysg Crew, a sex education company. Thank you.